Good afternoon, everybody, and welcome. This is King Philip's Regional Review. I'm Paul Zinni, Superintendent of the King Philip Regional School District, and I'm joined today with three guests. I'm joined by Dr. Ingrid Allardi from the Norfolk Public Schools, Dr. David Cameron from the Wrentham Public Schools, and Mr. David Raiche from the Plainville Public Schools. And together, we've all been working this fall to try to provide an educational opportunity for all of our students under the pandemic and the virus that we're all dealing with. And so I thought it might be a good activity today for us all to talk a little bit about the learning process and what's going on in each of our school districts. So I want to start off by saying welcome and thank you all.
Glad to be here.
I appreciate you saying that. We're very glad to have you here, and I put you on the spot by doing this. And so why don't we begin today by sharing with the community just a little bit about what's going on in each of our school districts. And so if I look at my clock, David, you're in the top left corner for me. And so I'm going to ask you to begin perhaps by just sharing a little bit about what's going on in Plainville.
Okay, so Plainville is using the hybrid model this year. That's the way we started, and we continued that way. So our students in grades 1 to 6, many come 2 days a week, some come 4 days a week, and about 20% of the students in grades 1 to 6 attend remotely every day. Our kindergarten model is one where kids come either 4 mornings a week or 4 afternoons a week, with Wednesday being a remote-only day. And preschool depends on whether they're in a half-day or full-day program as to the number of days and the amount of time that we're spending in the building. I know for me, the best days are Monday, Tuesdays, Thursdays, and Fridays when I can see the kids coming in and the kids leaving, and you can tell that they're very happy. We're very happy they're here, and there just seems to be a different feeling in the building on the days when the kids are here. And so, we're making the best of it. We know this is difficult for families. We know it's difficult for staff. They're all working very hard to try to make this work as much as possible. And we do look forward to the day where we feel that it's safe enough to get kids in even more regularly. So that's just quickly how things are here.
Great, thank you. Allan, how about Wrentham?
We're remarkably similar to what Dave described in Plainville. So I don't really need to elaborate on what our hybrid kids are doing. I will talk a little bit about the 20% or so of our students who are also in the remote-only alternative model. Those students are working only remotely, not in the school at all, with a teacher who's also remote, and they have about 3 to 3.5 hours of time spread throughout the day of direct time with the teacher, not including their special. And then they have some asynchronous work they do or independent work they do. And they also have time for lunch and for recess and for snacks. So they have a full school day spread out throughout the day with interactive time with the teacher, a specialist, and some independent work. But overall, things are going as well as can be expected. We'd love to have the students all back in. We're working hard to find ways for them to have live time with their teachers, doing the best we can.
Thank you. Dr. Allardi, how about you over in Norfolk? What are things looking like over there?
Sounds good. We're actually very similar to Wrentham and Plainville. We are also in the hybrid model. In Norfolk right now, we have only about 10% of our students that are fully remote, and they work with their remote teacher, as Allan described, for probably about 3.5 hours a day of direct instruction, and then they have their asynchronous and independent work that they do as well. Our other students, kindergarten comes in for 4 half days, and in grades 1 through 6, they come in 2 days a week with their cohort and have 3 days of remote learning. We are also in the process of really looking at how we can increase the amount of live instruction for students on those remote days. We've been piloting things at different grade levels and are working with the Norfolk Teachers Association to try to increase live learning on the remote days for our cohorts.
Great.
Paul, how about you? What's the middle school looking like in the high school?
So we have a lot of similarities with you. I do believe one of the differences is that our cohorts are run AB, remote AB, and I think you're all running AA, remote BB. Yeah. So the cohorts look a little bit different that way, but we are running with about 40% of our students in the building at one time, or they're in 40% of the time. They're in 2 days a week, and then they have a remote day on Wednesday where they're catching up with their teachers as a whole class. At the middle school, our students are able to stay in one classroom with their team of teachers rotating in. But at the high school, because of the complexity of all of those different schedules, every student has their own unique schedule, they are moving to a 7-period day and moving from classroom to classroom. But I have to say, I've been incredibly impressed with how well the students have adapted to this, how they were consistently wearing their masks. They're trying to adhere to the 6-foot distancing. They're really trying to follow those guidelines that we set forth for them so that they can stay in school and stay safe. Which actually leads me to my next question, staying safe. I know that many of our community members are concerned about public spaces and, the safety of our kids and the safety of our staff. And I know that you've all put a lot of effort into trying to keep your buildings safe for everybody. So perhaps, I'll go opposite way around this time. Ingrid, maybe you could share with us a little bit about some of the safety issues that you've put in, or things that you've done to keep everybody safe and healthy.
Sure. So, I would echo what you said earlier, Paul. Our kids have been amazing. They have very quickly learned new routines. They are doing a great job with their mask wearing, social distancing, hand washing, all of those protocols that we published in our reopening plan. We've also done a tremendous amount of work based on the report from the Harvard Public School of Health, Healthy Buildings report. We have really addressed and improved our HVAC and ventilation systems. We have HEPA filtration units in every classroom. We have plexiglass dividers for students and staff to do small group work so that they're safe. We are maintaining the 6 feet of social distancing within the classrooms, and as well as during lunchtime, we're dividing classes for lunch so that we can ensure that everybody is safe during those periods of time. Our younger students, a few classes at a time, do go to the cafeteria. So I think we have a really strong plan in place as far as protecting. Our cleaning and facilities team have been outstanding, continue to do a great job keeping the buildings clean and ready and healthy for students.
Great. Allan, how about you? What's going on over at Wrentham to keep things safe?
Sure. Thank you. Very similar to what Ingrid described, as I imagine all of us are, since we're all following the same state guidelines. We do have, because of a number of students in kindergarten who are in person, we have them eating in the cafeteria in individual desks that are spaced out so they can be 6 feet apart with their masks off. But our other grades are small enough in their classroom to have them eat in their classrooms. But we're able to maintain the distance, have the routine cleaning, have the masks on, frequent hand washing. And we've been doing a very nice job with our keeping students who are ill out of the school, which has prevented any virus spread in the school. We're very, very pleased with that. That's essential to allowing us to have the in-person learning. So thank you to the families for their support for that, keeping their kids home when they're ill.
Great. David, how about Plainville?
So in addition to some of the same physical special arrangements that have been made that Dr. Allardi and Dr. Cameron spoke about, I also know that we're all very concerned about the social emotional well-being of kids and their safety from that perspective. And so one of the things we've been able to do is actually I have a student support specialist in one building and a student adjustment counselor in the other building that are actually acting as specialists this year. So they're meeting with each classroom, both in person as well as live remote, delivering lessons that way, in addition to the social emotional lessons that classroom teachers delivered. So it's good to have those people with that expertise also checking in on kids and getting a good sense how they're doing, because I know that's something we're all concerned about. And I know, especially recently, there's been more and more reporting from the medical community about those things. So those are something that we've been able to put in place. I wish I could tell you that we put those in place because we had actually the additional funds to do it. Actually, that came about because I had to cut library media out of my program. And so that was a specialist period that I had to eliminate, and we filled it in with social emotional. So on the one hand, it's helpful. On the other hand, it came at a cost of losing something else. I know you deal with those same things, Paul, social emotional and physical things at the middle and high school. So why don't you share with us some of the things that are going on at our middle and high school?
Well, I think we're doing a lot of the same things that you all are, again, because we are talking all the time. And I think that's important for our communities to know that we meet probably under the pandemic, almost meet weekly with meetings like this, where we're sharing best practices and we're brainstorming so that we can try to make sure that there's continuity. But we've increased our guidance and staff, our school adjustment counselors, our social workers, all of those people who are trying to reach out to our students and trying to stay on top of this. But it does become hard for all of us when the students are home to maintain that kind of relationship. And when our teachers are teaching all day, that ability to have that personal contact with those students beyond the day becomes problematic as well. And so we are constantly looking at our information website, our Infinite Campus that keeps track of our grades, to look to see how our students are doing. Are any of our students in trouble academically? That's also an indicator for us, and we're trying to reach out in that way to try to maintain those kinds of check-ins with our students. But it does become problematic. Mm-hmm. I'm going to come back to something you were talking about with the spacing and the as far as safety goes. You were talking about those distances. And I think it's important for the community to know that the guidelines that we were told were 6 feet wherever possible, but no more than 3 feet, or no less than 3 feet, excuse me. And so I know at the middle school and the high school, to get enough desks into the classroom to go to a 2-cohort model, we had to go closer to the 3-foot distance. Our classrooms are smaller than many places, and our class sizes, in some cases, are running as high as 35. And so that has been a problem for us. But I think you've been a little bit more fortunate at the elementary level as far as distances go, but I don't want to make that assumption. So, Allan, what about the distancing in your classrooms? What are we looking at there?
Sure. So we, in most of our classrooms, we're able to typically have the students 6 feet apart. In some of the classrooms, particularly in kindergarten and a few of the upper grades, when they're in class, are closer. They never are closer than the 3-foot mark. So they're oftentimes somewhere in between 3 and 6 feet. However, whenever their masks are off, they're always 6 feet or more apart.
Great. What about Plainville, Dave?
For the most part, we're able to adhere to the 6-foot distance. In our upper grades, especially in 5th and 6th grade, where our class sizes are bigger, we're closer to the 5-foot mark. But we've been able to pretty much, for the most part, keep it there with kids.
Norfolk, how about that, Ingrid?
Thanks, Paul, for asking. So for the most part, across the district, we are adhering to the 6 feet of social distancing in the classrooms. The biggest challenge that we have in Norfolk is that we have been under a critical space crunch at our lower elementary school for a number of years. We have an application into MSBA, I'm losing the acronym, but yes, Municipal Building Authority, yes. For a building project. So at the HLJ this year, in order to accommodate bringing students back, we have had to give up a portion of our gym space, our library, our art room, and music room. We don't have any special subject classrooms this year because we had to relocate office space to areas where you had windows and ventilation. So our biggest challenge is, even if we were to reduce social distancing in some of our classrooms, we do not have the space to accommodate those required times that kids have to be 6 feet apart for lunch, for mask breaks, for those other opportunities. We just don't have the space for it. So that's been our biggest challenge. We are looking at, as everybody is, conditions that would allow us to maybe bring more students back, and thinking about our youngest students first. But there are barriers for us in terms of space at the lower elementary school to accommodate those other times.
That's been an issue for us as well, and I'm going to circle back to that. You're talking about those unstructured times, or those times when the students have to be unmasked. So those mask breaks and things, we've been able to manage that, getting our students outside, or we have certain locations of the building where we can keep them over 6 feet apart and allow them to unmask. But lunch has been a tremendous challenge for us. Our field house at the high school, for example, it has about 200 desks in it. And we're running 4 lunch periods. We're starting at 10:50 in the morning to start serving lunch to get them all in there so that they can be at least 6 feet or more apart when they unmask to eat their food. And so lunch becomes the challenge there. And it would be even if we tried to eat in the classrooms, because our desks are only 3 feet apart.
Right.
But if they have to unmask, then the space is too small for them to unmask to eat. And so Ingrid mentioned that as an issue for Norfolk. Are you seeing that in Wrentham, Allan?
Say that again?
Are you seeing the same issue as far as those things like lunch and the 6 foot or spacing being an issue for you?
No, we're able to accommodate most classes. We have enough space for them to eat in their classroom with their masks off, no problem. As I mentioned previously, we have a little bit of a challenge in kindergarten because of the number of kindergartners who are here. And so for those students, we have to have them eat in the cafeteria in individual desks. It looks unusual when you head into our cafeteria now and see an array of desks out there. But that's how we can accommodate the 6 foot standard and the cleaning associated with that for those students. But otherwise, we're able to make it work.
Allan, can I just ask a question? Because our kids are currently eating in the classroom at most grade levels, and we're using the cafeteria for the overflow. But is that a barrier for you in bringing more kids back?
Yes, that's definitely a barrier for us. The main challenges in bringing more kids back for in-person learning, number one, is transportation. We do not have a walk-friendly school campus here. We're not neighborhood schools in Wrentham. Or any of us. And so students rely on transportation. And because of the guidance regarding the number of students and the spacing allowed on the bus, we are at capacity for our bus ridership. And we don't have enough room for drop off to accommodate even the number of cars we have now. Every morning we're backing traffic up into the center of town. So traffic and busing are the primary issues that are preventing us from having more students back. But then the secondary issue would be around space. If we put any more students in any of our classes, we would be beyond the 6 foot threshold, certainly. And then it would be problematic because we wouldn't have the overflow space to have students with masks off. So there are certainly logistical challenges with bringing any more students back.
Well, when you talk about that transportation piece, it sounds like you're also describing King Philip. We have some of our traffic flowing into the streets. Our buses are filled to capacity. And so we're seeing those same transportation issues. And even our parking lots are full. Although you drive by and see some of your student spots open, because of the AB piece, we can't double book those spaces because our students could be switching off and need the space. And so we can't assign it to 2 students. David, how about yourself? Are you seeing the similar issues than what we're describing?
In some ways, I guess the good news at Wood School, which is our grade 4 to 6 school, is that we've been able to position classrooms so that between each pair of classrooms, there's a room that we can use for breakout space, whether that's lunchtime or whether it might be a place for small group instruction. The bad news side of that is the fact that we're able to accomplish that because we had a significant reduction in teaching staff. So class sizes got bigger in 4, 5, and 6, but it gave us some space. A little bit more challenging at Jackson School, which are our younger kids. We've been able to have class sizes be a little smaller there, so we don't have quite as much breakout space. And obviously, little body, as we all know, little bodies are a little tougher to control in terms of reminding them about movement. But all in all, I think the kids are doing a great job. They respond very well to reminders, and so we're making it work.
So our viewers at home are hearing a lot about what we've got in place. I'm not sure that everybody recognizes just how much planning goes into all of that and some of the subtle details that have to be worked out sometimes. So I'm just going to throw this out there. Maybe you'd be willing to share a little bit about how some of that planning took place to get to the models that you're actually using right now.
Sure.
Well, pause so someone to fill it in. There you go.
I think for all of us, it was a very interesting summer, a very busy summer, and it was like we kept waiting for the next piece of information and hoping that the plans we were starting to put together wouldn't have to be rewritten because a new piece of guidance came out or something else was going to change. So I think that made it very, very challenging because we all want to do what's best for kids. We all want to make sure that our staff are in a good place and can do the important work they do every day. So I think that's always was very much a challenge in the late summer and early fall. It still continues to be a bit of a challenge as we go forward. but especially at the beginning of the year, the amount of planning and now, right now, just getting through every day because we know that there aren't a lot of substitutes. So when we do have staff that aren't able to come in for whatever reason, it's tough to find people. So we're constantly, the principals are constantly shuffling staff and constantly jumping into classrooms to take over for periods of time. And as you know, from time to time, we all have to take on some of those roles too. In whatever part of our building or our programs need help, we all have to be willing to do anything and everything just to kind of get it done.
Exactly. Ingrid, I think you were also going to share something.
I would say very similar to Dave, and I know because we communicated a lot over the summer that the summer was intense for everybody in terms of trying to manage the facilities changes that we needed to make in order to make the building safe. A tremendous amount of work on curriculum. We had to revise curriculum, think about what skills needed to be reinforced that students may not have had as much practice with in the spring. We made some significant adjustments in terms of our mental health programs. We have now daily check-ins for every student where they're providing data about how they're feeling, concerns they have, because we also were very concerned about how kids were coming back to school after such a long period of closure and what supports we might need to put in place for the mental and behavioral health needs. So it was a lot of work over the summer, looking for grant funding in order to offset some of the additional costs for PPE gear. So it was a very busy summer, as I know everybody has had. And I do think that, as Dave said, one of the other things that we're struggling with now, and we continue to work with the planning on, is recruiting new substitutes. With the quarantine issues that when staff are quarantined, we as small communities have limited resources in terms of reallocating staff. And as Dave said, we have had principals covering classrooms, specialists covering classrooms in order to keep in-person learning going. And I think as far as planning for the future, we all continue to gather data on how things are going. We know this is not perfect. We in Norfolk have really been looking at how could we increase, again, live instruction on those remote days. Our teachers have been fantastic about trying new things on, contributing to the planning, looking at the research and best practice. But everybody's working really hard, and it's challenging.
I would definitely put out a plug that if anyone out there is interested in subbing, we would all be very happy to speak with you, because I think every one of us on the screen has covered a class or a lunch duty or a dismissal or all of the above on any given day. And they're just the people on out there. And I know at the secondary level that sometimes if we had a shortage of subs, we could, for lack of a better term, warehouse the students. Like you might be able to put them all in a library and have one teacher cover 3 classes for a period just to make sure that everybody's safe. It wasn't the best learning environment, but you knew they were safe for the day. Because of all those spaces being used as learning spaces, we don't have the luxury of those big spaces to put kids in if we don't have the bodies to supervise them. So it becomes even more perilous for us at that point. Allan, I don't want to lose you in this too. I know you looking at all of these areas and, we were talking about that planning process.
Yes, thank you. I don't really have much to add on to what all 3 of you have said. It was certainly very comprehensive. I know that the 3 of us worked together very closely, and then we took the feedback that we reviewed based on the guidance from the state, worked with local stakeholders in our districts and tried to develop the most robust and meaningful plans that we could for our students. And I do think that regardless of what the instruction model looks like in any of the 4 districts, I am confident that the students are making effective progress, and learning might look different this year, but learning is happening. And I'm very proud of the work that we've done in Wrentham, and I think that it's reflective of our King Philip regional community, that a lot of great things are still happening here despite the challenges, and I'm happy to be a part of all that.
I think we're all struggling with trying to revamp things to make sure that everything goes well. And I know that for us, I feel like sometimes we're dealing with the Goldilocks syndrome. This is too hot, this is too cold, trying to find that sweet spot of just right. And I know that, we hear from some of our families and our students that they're not seeing enough or robust enough work during the course of the days, especially on those days that they're home. And then I'm hearing from other families that their kids are are inundated with work and they're having trouble keeping up with it. And so I know our teachers are struggling to try to, to make all of that work and figure that out. I wonder about all of you. I'm sure you're hearing similar things that, people are concerned. They want to make, have their students in school, and others that want to keep them home. And so what are you all hearing in that direction?
I think, Paul, you stated it very, very accurately. I think people have very different perspectives and feelings on safety protocols and practices. As you're experiencing, we have had an increase in cases in the Norfolk community, and we're heading into our 5th week of being in the red. There were quite a few cases at the Norfolk prison, but outside of that, the cases in the community have risen significantly. So we have more parents that are feeling like they are considering transitioning to a remote-only model for their own personal reasons. I think everybody is doing 100% the best they can at managing that. But we are we do hear from some parents that students are finishing their work early. They are ready for more. We have other parents saying it's really hard for kids to get through what they're being assigned. I think our individual teachers have been great about talking with individual families and making adjustments and accommodations based on their own students' needs. But it is tough to really balance out the resources and support students have for their remote programming, the challenges they may encounter, and that's an issue that we are struggling with and working on.
And I think one of the messages that I've been saying, and I'm sure you're saying as well, is that if you are a family that's seeing your child struggle, too much, too little, mental health issues, contact us. Get in touch with the teachers directly if it's a classroom or a work-related, issue. If it's around mental health, let your guidance department know, your school administrators know, and they can help you with that. There are a lot of resources out there. And I know you mentioned some of them earlier. And I guess, Ingrid was just sharing that. I would turn to David and to Allan if there are other things that you'd like to add to, what Ingrid and I have just said.
I would add that I think teachers, and I think we're finding this in all of our communities, are doing a great job of responding when they hear from parents, whether it's kids not having enough time and being on overload, trying to complete everything, or having more time. And I think they're being pretty responsive. It's something that I check on with the principals regularly, but I don't hear that they get many calls either. So that leads me to believe that most of the parents are pretty happy with the response they're getting from the teachers. I know the survey we did about 3 weeks ago or so. Yes, we did hear that there were a number of parents that wanted their kids in school more frequently, as well as a number who said keep it the way it is right now. What we did hear from them, though, is that by and large, they were being responded to by the teachers, and they felt that was a strong point of the plans going on in the district. So kudos to the staff for staying in communication with parents and families.
I'm going to wrap things up at this point because our time is growing short, and I'm going to once again thank my guests today, David Raiche, Allan Cameron, and Ingrid Allardi, the superintendents in Plainville, Wrentham, and Norfolk, for joining me today. Although we call this show, King Philip's Regional Review, it really is a review of all the Tri-Town schools right now and what's going on with that. I thank you again for spending some time today talking about how school is going right now under the pandemic, and I wish everybody at home who is watching the show a healthy and happy holiday season, and hopefully happy and healthy new year. So thank you all once again, and good day.